Hello, my name is Kathie J, and today we are joined by Lisa Fagan. She's the CEO of Smith Medical Specialty Care of Denver. No, Smith Medical Direct. Say it right, Lisa.
It's Smith Medical Direct Specialty Care.
Okay, and the direct is very important in the title because
It
we're
is.
talking about direct pay surgery. So when I met Lisa for Smith Medical, what you do at Smith Medical, it truly blows my mind because I didn't know that these kind of options were available
Yes.
in our healthcare system. So that's why I called you in because I was like, other people need to know what's happening out there. So
Absolutely.
let's start with our healthcare system. It's broken.
Yes,
It's
is.
broken. And a lot of it has to do with the way that we're being charged for stuff. It's ridiculous. I don't know if this is what you're being charged. I don't know if this is what someone's being charged in another state. Help us understand why it's allowed to be like that.
The lack of transparency, the insurance companies have made it so muddy that nobody actually knows how much it costs
Yeah.
for a surgery. And so we cut out all that friction and made affordable surgeries online. You can go on our website right now and see exactly what it costs for a total shoulder, rotator cuff, total knee. And it's just one price, all up front, completely clear.
Yeah, so that's the joy of what Smith Medical does is the direct pay is it's quality surgery and it's one charge, one price, and that does cover the facility, the surgeon, the care. I mean, it's amazing. Everything in that one price. How do you get away with that? How do you do that?
Yeah, absolutely. So I want to go back to quality really quickly,
Please.
just because quality is our number one priority. And we are able to get the best surgeons in Colorado to come to us because we're paying them fast. We're paying them up front or like right after the procedure is done. And there's no denials from insurance companies. Their physicians are constantly fighting to get paid from the insurance companies their contracted price.
Yeah.
And so they love working with us because we pay them fast. Like, you need a total knee, done. This is the price. This is what you get paid. So our quality of care is incredibly important to us. And I think that people think just because it's affordable, it's cheaper, right?
Yeah, right.
And that's
right.
not true. We actually have higher quality care with the best surgeons, and it's affordable. And how are we able to do that?
Yeah, I mean, let's go.
Yeah.
How?
Well, we just cut out all the fluff. We say how much does it cost in the OR? You take the disposables, you put that into the price. You put the implant into the price, and you put the surgeons and the anesthesia. Everything else, we're not trying to make a ton of money off the procedure. We're giving the patient the correct price, and technically there are pricings in facilities. Like Medicare is really low, so we're not quite Medicare prices, but we're comparable.
Yeah.
So
See, and that's the craziest thing, Lisa, is we're speaking today with Lisa Fagan. She is the CEO of Smith Medical Direct Specialty Care of Denver. And what you do over there at Smith Medical, it blows my mind because most of us just think, well, my insurance said this.
Yes.
I'm going to this doctor. They said this. Now I'm going to have the surgery. This is out of pocket. Now I have all these bills coming. Let's go back to these bills and what they pay. Like, you guys can charge one fee flat. How come insurance companies how come they won't charge one fee flat? Your insurance is different from my insurance, and they're charging something different for the same surgery. How is it allowed?
I 100% agree with you. The same CPT code at the same hospital with the same physician can vary 400%. That's insane.
Huge. That's thousands of dollars.
It's
That's
thousands
huge.
a total joint can vary anywhere from like 50,000 to 200,000. And that the implant doesn't change, the facility doesn't change, so the price should not change.
It shouldn't change.
No.
So that is all based on the corruption of our insurance.
Absolutely.
Okay. And you, before coming over here to Smith Medical Direct, you were plenty of years in the healthcare industry.
Yeah, I've ran
You've seen it.
Yeah, I've ran surgery centers for 15 years. And it is frustrating because I would talk to patients that were like, I had a $1,500 deductible. I didn't think I'd have to pay more. But then you have like an 80-20, and I mean, it's very confusing, right? And then they get a bill from the physician. They get a bill from the anesthesia. They get a bill from DME. They get a bill from labs.
Yes.
They get them all over 6 months after the procedure. So they had no idea what they were going to pay. And unfortunately, they're very frustrated by the end. It shouldn't be this muddy.
It shouldn't. It shouldn't. So now let's talk about when it comes to the one fee that you charge. So obviously it's still a big fee, but it comes in 40% less than if you were going through your insurance and stuff. Talk to me about that.
Yeah, it's typically 40 to 60% less.
That you would save if you could
save.
pay just a one direct fee.
Absolutely. And so people that are completely uninsured, it is key, right? Because this is a transparent bundle price, and they pay one cost altogether. They never will get billed on the back end. For people with high deductible plans, they should absolutely look at us first before they go and pay through their insurance. Because people that have a $10,000, $15,000 deductible, if you have a hernia, for instance, which is one of our like most popular procedures, because most of Americans have a hernia.
Oh yeah,
but
yeah, we do.
Yeah, but our whole bundle price is $6,644. So if you have a $15,000 deductible, you can save $6,000.
Yes,
by
going direct with you guys
and not using your insurance.
Okay,
Absolutely.
so how many different surgeries do your doctors perform?
Oh, goodness. So we have, we're multi-specialty, so it's orthopedic, spine, general, ENT, GYN, GI, and so much more. So we do breast biopsies. We take care of breast cancer. We do tons and tons of procedures. So you should always look at us first and see if we cover it.
Yeah, I'm truly shocked. So it's not just because I was thinking, oh, a knee replacement and a joint replacement stuff. No, you do
a little bit of everything.
Yeah, a little bit of everything. And let's talk about your doctors one more time.
Yeah.
I would assume that they are just as frustrated with the healthcare system as we are. So they love your model.
Yeah. Unfortunately, our physicians are burnt out.
Yeah.
Because they're getting paid less than they were 10 years ago.
And doing more.
And they have to see twice as many patients. And it is frustrating that they have to walk in and they're like, okay, I have 15 minutes or less to talk to this patient. But it's not a surgery is not a 15-minute conversation with your surgeon.
No.
You need the 45 minutes. Talk about your choices, see what else you can do prior to surgery, see what you're supposed to be doing after surgery.
Yes.
Yeah, so physicians they're burnt out, unfortunately. So they love us because we refer patients to them, we pay them, and we pay them faster. And there's no denials. There are no pre-authorizations. They say to us, Lisa, this patient needs a total knee, or this patient needs spine surgery. These poor spine patients have to go through, when you try and get surgery through your insurance for spine, it's like the number one surgery that is denied.
Is it?
Yes.
Wow.
And these people are in so much pain.
Oh, for real.
And they see their physicians, and then the physician's like, yes, you need surgery. But in order to get it covered, they have to go through PT. They have to see a therapist.
All of these hoops that insurance makes you jump through.
6-9 months later, still gets denied. They can't have surgery, and back pain is debilitating.
It is. It'll ruin your life.
It will ruin your life.
And before you know it, those people are on a decline to death because their lack of life.
Absolutely.
My mother has issues with her back right now, and it just kills me that she can't get out there, and she's doing the physical therapy. And that's why I responded so emotionally, because it's a nightmare that they make you go through when the end of the day you needed the surgery.
Absolutely.
Right.
Spine is our number one case that we're getting from like all over the United States.
You mean like fusion, spine fusion kind of stuff?
Well, it could be a microdiscectomy, a laminectomy, a fusion.
God bless you.
Yeah. It's just like spine procedures get denied all the time, and people are looking for cash pay procedures because it's so expensive if you do it in a hospital. You're talking about hundreds of thousands of dollars, and with us it probably varies, and it starts at like $12,000 to like $40,000.
See, that is crazy.
It's crazy.
What is the process? So say I'm watching right now, and I'm like, you know what? I would love to get this looked at, or I'd love to know their opinion on this that I've, had denied, blah, blah, blah. So it starts with an appointment and a doctor consultation, and they look over the stuff. They move your bone, right? And see how, and because you are now with the doctor that would be doing the surgery on you.
Absolutely. So a lot of people, they come all sorts of different ways, right? So you have the patient that calls us and is like, I don't have insurance, but I have knee pain.
Yes.
So then they have no imaging or anything yet, right? So we send them to for a consultation.
Yeah.
We get some imaging for them. The doctor says they need this procedure done.
And here's your price.
And here's your price.
Yeah.
Yep. Or you have the patient that has been living with it, knows exactly what they need done. They probably have medical records. They have imaging. And so
many.
So many,
yeah.
So they give us a call. We refer them to a physician again because you still want to see the surgeon that you'd have surgery with. They look over the medical records. They, of course, examine them and say, yes, we agree with you. This is and what you need done. And then, of course, the surgery price.
So what happens if I have that surgery price and you get in there? Something happens when you're in there. What does... Do I wake up and there's more price?
Never. Nope. So things happen in surgery, absolutely. But that's a very low percentage. So we'll eat the costs. So we'll never bill you on the back end for another procedure. We'll take care of it. Yeah, no, absolutely.
Smith Medical Direct Specialty Care. You're crazy. Okay. All right. Wow. Okay.
Yeah.
Because you want to be that transparent about the price.
Absolutely.
And about how honest you're trying to be up front.
Yes, absolutely. And we stand by our quality of care. So if you get an infection and need like a washout, you'll come back and we'll take care of it for free.
Wow, that's awesome. That is awesome. That is awesome. We are speaking today with Lisa Fagan. She is the CEO of Smith Medical Direct Specialty Care. We have how many? One office in Littleton.
Yes, as of right now, our goal is to have about 10 of them in the United States, but Smith Medical is our first one here.
Okay, no, that's pretty great. Okay, so can people have their? Are we on a 6-month waiting list to get these surgeries?
No, so they can get in within the week.
What?
Yep. And
your
surgery,
pain can be gone in a week.
Yes, absolutely. That's again, when cutting out the friction. The doctors want to see our patients because, of course, they're easier. The whole process is easier. So our doctors hold time for our patients. So if you have a fracture and you're at the ER right now, literally give us a call, see how much it will be, leave the ER, and save thousands of dollars.
Yes, so this would be for people that, like you said, there's the uninsured, but also the people that have insurance.
Yes.
That something has happened and they're like, tell us who really benefits from Smith Medical.
Yes, multiple people benefit from Smith Medical. So there's 30 million Americans right now in the United States that are uninsured. So those 30 million Americans completely benefit, right?
Yes.
Because it's transparent bundled pricing. The people with high deductible plans, which is
everyone
now.
Everyone. You do the high deductible just praying that nothing bad's going to happen.
Absolutely.
Yeah.
But I think the most important message out there right now is that in order to fix our healthcare system, the consumer has to take their healthcare into their own hands. So you cannot just follow the system anymore because the system is not set up for them to succeed, unfortunately.
Right.
It's just not.
The system is set up to milk you.
It is, 100%.
To milk you and your insurance so that they can get more money, right?
Yes. Even though I carry insurance, I always ask, what is your cash pay rate first? Okay. Everywhere you go.
Okay. I'm so glad you brought this point up, Lisa. This is another reason why I was like, I want to talk to you. And okay, I would never have the guts to ask those kind of questions. Tell us those questions that you ask when you.
It doesn't have to be with surgery. Anytime you're dealing with health, or like just with your health care, you go and get a bunch of labs, you should say, how much is your cash pay rate instead of using my insurance? Or how much is the imaging?
Right.
Like a lot of times an MRI can be on your bill, so it goes towards your deductible and it will be $1,500. A cash pay rate is $450.
Wow. So you guys do imaging?
Well, we have centers.
You have the centers that you do, and they have better pricing.
But but that's to everyone. It's the same. Like if you went in and you were like, "How much is that MRI cash?" They would tell you $450.
Okay, so I would think that they would get mad at me and look at me like, well, that's none of your business. You have insurance.
Well, I mean, I think if you just don't even ask them the insurance yet, I would just say, how much is your cash pay rate? That's what I do with everything.
Oh,
I mean,
wow.
absolutely everything. With labs, everything. I'm like, how much is your cash pay rate? My husband went and wanted to, he's getting older and he's like,
Yeah.
I just don't feel my young self anymore.
For sure.
I want to get like a complete lab drawn,
Blood
right?
panel. Everyone talks
Yes.
about wanting one of those.
Yes.
Yes.
It was going to cost him $1,500. He went to a cash pay place online. We sent in his blood, $150.
It told him everything.
Yep, told him everything.
Dang.
Yes.
You're right.
I mean, you're talking about saving like $1,000.
Well, you hear about these places,
Yes.
Lisa, but you never know if they're trustworthy. If it's really the doctors. I mean, you hear about the price difference and you think, well, that can't be
Yes.
can't be quality. But you're telling me it's quality and it's people that
is.
are sick of the other. It's the real quality
And I think
that wants to get back to the people as fast as it can.
absolutely. And I think their direct pay places are becoming the new norm.
Yeah.
Right? So primary care, there's direct pay primary cares everywhere, all over the United States now.
Yes.
And I mean, they're light years ahead of surgery. And you can pay like $70 a month or something like that, subscription model, right? And you have a direct primary care at your fingertips.
On beck and call. Yeah.
Like, don't feel good, runny nose. Hey, how's it going?
Yeah,
And,
right. Let me call
like,
that in for you.
Like my daughter has strep. I think I have strep. Next
Yep.
day you have a visit, or same day you have a visit.
Right.
So everything is moving towards the consumer side of putting it into your own hands. So I agree with you that you're like, oh, you kind of feel weird about asking about cash pay.
Yeah.
But I think it's becoming the new norm that people don't really blink an eye anymore.
You people on your side of the
Yeah.
business. Okay. That.
Because, I mean, we go to conferences, there are labs, x-ray, imaging, DPCs, PT,
All direct
OT,
paid stuff.
everything is there,
Wow.
right? Surgery, everybody's there now, and we're all just trying to change healthcare for the better.
Yeah, no, thank goodness you are there.
Yeah.
Thank goodness. We're speaking with Lisa. She's the CEO of Smith Medical. So Smith Medical, you had told me that employers
Yes.
also use you, which that to me is crazy. You say that they save more money paying out of pocket for. Explain that.
So actually, employers have been being self-funded for years now. The large employers have been doing it for much longer.
You mean
they
like
could
with
take
millions of employees? When you say
millions,
large
yeah.
employee, I'm thinking
Walmart,
100 people.
Google,
No.
Amazon, they're
What?
all doing it.
Walmart, Google, they all kind of do this with
They
their
all
insurance.
do, yes, and it's called self-funded, and you can talk to your broker about it, and it can save the employers 40 to 60% on their employees' health insurance year after year.
Because
And-
the insurance is lower that the employer is paying, and it's still cheaper if
Yep.
you have an accident for me to pay that out of pocket, direct pay Smith Medical, than it would be for me dealing with the insurance as the
Absolutely.
employer.
So basically,
Look at that! I think I figured it out. Yes.
yeah. So basically, the employer still carries the health insurance, like Blue Cross, Cigna,
Yeah.
all the big ones, right, for their employees. But it's a high deductible plan, as we talked. So it could be $10,000, $15,000 if you want to use your insurance. However, if they use their insurance, then the employer still gets dinged on a premium, right? So what the employer says is, do not use your insurance if you don't have to, except for like catastrophic things,
Yeah.
like, if you get in a car accident, if you have to go to the ER, things like that.
Right.
But if you just need a surgery, you get these 15 choices, and we pay for everything. You don't pay a copayment, you pay no deductible, nothing.
Right.
So they're paying us the $20,000 for the total joint
Yeah.
instead of the employee. So their employee is getting incredible health care because
Right.
they're
They
not
just
paying,
had everything paid for, all
for-
of those
yeah.
visits, everything.
because most of Americans cannot afford a $300 medical bill.
No, they
So when
can't.
their employer's paying for their surgery, they're finally taking care of themselves, which
Yes.
is incredible.
Yes.
It's incredible.
That's just crazy. Yeah, that's incredible to me. That's just
Yeah.
okay. So the one price, one more time, let's talk about it. It covers what?
It covers the physician, anesthesia, facility, implant, labs, any like braces or anything like that day of, and 90 days of post-op
That's
follow-ups.
huge. That's huge.
Yeah, really the only thing it doesn't cover is the consultation, the first consultation.
Okay. And then physical therapy, you have a suggestion where they go for that.
Yep.
Because you did all this work. You still want them to continue with the physical therapy.
And sometimes people will be like, oh, I want to use my insurance for that portion, which they're welcome to.
Right.
But yeah, cash pay, they just get a better price if you go cash.
I love that. And it's not like everybody has that kind of cash laying around, but like you said, your patients, once they come to you, they're probably willing to pay to have a good quality of life and to not deal with the crap of the insurance.
And I think that the scariest part for people is they have no idea what they're going to have to pay after the procedure is done.
Right.
Even when I gave birth, I mean, I think I got bills for an entire year.
Yes.
And to be honest, I don't even know how much I paid.
I
I just kept paying and paying and paying.
You're right.
Yes.
Like, and then you have to go back and be like, I thought I paid something that was $31. And then you'd be like, oh, that was $34. Well, obviously this is something new. It's just ridiculous and it's not fair.
Yeah, it's not fair. And so I'm not saying don't use your insurance. I'm saying do your research.
Yes.
So look and see, talk to your doctor and say, okay, well, and the other thing that people don't understand is they'll give us a call and they'll say, well, my surgeon said it was $2,000. I'm like, their portion is $2,000. Now you have to call anesthesia. Now you have to call the facility.
So smart. So when they say $2,000, you're like, that's my out-of-pocket portion for just that.
Just them.
Not whatever the out-of-pocket portion will be for the anesthesia and all of that. You're right, because those are those little bills that keep coming forever.
Forever.
Yeah.
So take a look at it. Look at what it would be with your insurance. Look at it what it would be out of pocket, and then you can decide.
And what do I need to ask him? I ask
what
him,
is the cash pay price?
I'm so nervous to even ask Lisa that.
Okay,
I'm like,
put me on the
say
phone.
it again.
I'll talk to them and be like, "Excuse me, we would like cash pay price."
I need a cash pay price, please. Thank you very much. Goodbye. Lisa, this has been so eye-opening, and it's just. And so if people go online to Smith Medical, smithmedical.com, Smith Medical Direct. Yes, .com. They see everything that you offer.
Yes. All of our prices are just right online for them to view.
That's how transparent it is.
Completely transparent. It's like going to a fast food restaurant, ordering off the menu.
It's making me giggle because I just don't believe it.
I know.
Because I'm like, stop it. Something's going to happen. So, but that's pretty awesome. And I love the fact that you have the best surgeons, the ones that are like, just let me do my work. Is kind of, so.
I mean, we just want to put the care back in the surgeon and patient's hands.
Yes,
like
absolutely.
They get to choose what their health plan is.
As it should be.
Not what the insurance decides that they get approved.
Yeah, no, exactly. Oh, the insurance. All right, Lisa, before I let you go today, what else do you want us to know about Smith Medical?
I think that the most important thing that people need to take away is just putting your healthcare in your own hands.
Yeah.
Taking a look at all of your choices. Smith Medical is there for you, but there's it's not just in surgical, right? But anybody needs to take a look and see what your options are. Ask for the cash pay price.
Yeah.
And see, is it worth going through my insurance or is it worth just paying direct?
You said even biopsies. I mean,
yes,
even
everything.
that. Yeah,
absolutely everything. And we do biopsies as well. So if you need, just give us a call.
Yeah.
And if you want to ask if we take care of something, just give us a call. We're
I
happy
love
to
how cool
help
you
you.
just give us a call.
Just give us a call.
Like I'm telling you right now, just call Smith Medical.
And then we'll tell you if we can't do it, we'll tell you other great places that are affordable that can.
I love that. It's like calling the cool older sister that you're like, what do you mean? It was that easy? Why did you tell me these? It's like somebody had the TikTok answer.
Yeah, absolutely.
All right. So thank you, Lisa. Thank you very much. And Smith Medical Smith Medical Direct Specialty Care of Denver. Well, of Colorado, because you're in Littleton.
Yeah, we're in Littleton, but it is of Denver.
Okay, right. All right. Thank you so much. And please put the care back in healthcare and put it in your own hands. Thank you so much, Lisa.
Oh, thanks for having me.
Kathie J.